And infrared imaging will be okay. All right.
You
I'll
have a
stop.
note that we're going on?
I did. Uh-huh.
Okay.
Well, good morning, Shirley.
Hello.
Hello. Here we are again. Let's see. I'll introduce myself. I'm Victoria DaCosta, and I'm a non-clinical practicing dental hygienist, and we'll discuss a lot of that today, what that means. I practiced dental hygiene for 25 years as a clinical registered dental hygienist in various types of dental clinical settings, seeing the need for change in our dental hygiene department. And I would really like to see our profession evolve into more data, including medical and dental combinations, and see how much our dental field really does contribute to the medical industry. We are definitely inside the body, aren't we, Shirley?
Yeah, and we're in a shared domain with a
Yes.
lot of other practitioners. I was speaking last week, Friday, in the Chicago area on this topic of collaboration and what the dental hygienist role was in this collaboration. I think what happens is these dental hygienists keep getting asked to do more and more. They're asked to do it in less and less time, and they're like, F this. I'm out. I can't do it. I don't want to do it. I have zero respect. I have more demands than ever. And this isn't working for me anymore. So my role was to try to make this as easy as possible to add a dental hygienist as part of the collaboration partnership between all medical and dental specialties.
Well, Shirley, exactly. And what I saw, and you have too, as a dental hygienist, and I think we're going to reach a lot of our dental hygiene sisters. And there's a bond between us, whether we know it or not. We find each other in different circumstances, or in the city. I might find somebody here in Las Vegas that was a practicing dental hygienist at one time, and now she's selling real estate. But
Right.
there's that certain bond,
But
you
they're
have that.
afraid of sales. They hate sales. And then
I
they go
know.
into real estate. And I'm like, dude, what is going on?
Well, you know what? The fact that they got into it, dental hygiene, the fact that there's such a demand for the profession to grow. And think about it. When I got into dental hygiene, there were 25 seats open in the program and over 200 applications. So we're competing against each other to get into a field that has really high demand for high intellectual individuals and people who are highly motivated and highly skilled with their, motor skills. And then we get into an environment clinically that doesn't even use maybe 90% of what we were taught. Oh, that is major frustration. And then add the business part where there's no growth and
Right.
there's no protection for us and there's no retirement future. And I see what is happening now in our field is do more in less time and your body is fried. And the health conditions of these hygienists it's decreasing in greater numbers, and the illnesses. That's what happened to me. Not that I was doing more and less, but I was exposed to radiation poisoning. And one of the things that everyone kept saying is, how did this happen? Well, if you do the math and you do the research, stray radiation is real. And walking out of that operatory to take an x-ray doesn't mean you're not protected. And my thyroid wasn't protected. I didn't wear any lead apron and I didn't wear any lead coverage. And so when I was diagnosed with thyroid cancer, after 25 years of devoting my life to dental hygiene service full time, I had nowhere to go. Where could I stay? I mean, I had to literally figure this out. And I love working with patients and I love teaching and I love the contact and helping people become well. And I believe that's a lot of dental hygienists out there. We are going into the profession for this. How can we not be a part of the medical? We are, and we're the link, we're the gate, we're everything, I think, as far as the bridge goes. And we are inside the body out of all the professions I've done my research in, we're inside the body the longest. We have the more time to do the observations. We have the background in the anatomy training. So where is this disconnect? And that's what we're going to talk about today. Where this disconnect is to use our knowledge, it's getting wasted, totally wasted.
Yeah. Well, I did point that out in my little speech. I only had 45 minutes. You can't really explore a lot during that amount of time. But everything we learned, I have a picture of a completely highlighted page in a textbook, like every single word. And I was like, and we were tested on everything, and then you get out and you're like, oh no, just get them cleaned up. We don't really care. Just make them want to come back. That's like the main role. And we're not taught about how to get patients to come back. To me, I want to deliver excellent care. And to me, that's what a patient is going to want to come back for. Not because I have good conversational skills. It's because I have good clinical skills and good clinical observations and an ability to teach what you were just saying about the body and how it affects them personally.
I have a question. Did you ever get in trouble for talking about systemic issues?
For crying out loud, I was in trouble all the time. There was like a worn out spot in the doctor's office, in the carpet where I was standing all the time. I got yelled at for calling floss the F word. And I was like, oh, you people, I just don't get it. I have a sense of humor. It's pretty sharp. And if you're not on board with that, then I don't belong here. I don't know what else to tell you. So, all right. So we're going to talk about like ramping up. So one of the ramp ups that has been taking a lot of energy and has had a lot of traction in the last 10 years is myofunctional therapy. What you've been doing with thermography even longer than 10 years, it's only 10 years because that's all I've been involved in it, maybe 11. But this thermography thing is a really big deal. And it is as big as myofunctional therapy and airway treatment. And its time has really come. And I hope that we can put some wheels on this thing and make it drive.
Well, I'll tell you, Shirley, it's safe. There's no radiation.
No radiation.
Infrared imaging is safer than dental X-ray imaging. And there's a lot of
the patient and the provider, and the information is superior as an entry point in dentistry. And this is what I had to point out on Friday last week, because there were a bunch of ENTs there, and they're like, oh yeah, you don't want to give all these x-rays and all this stuff. I'm like, we always take x-rays in advance. We're looking for problems to ward off, to get in front of. And maybe that's not a proper use of x-rays anymore, since we have this high level thermography option.
Well, it's an interesting statement. You've got the dental field is out of the whole healthcare industry in the United States, I wouldn't say other countries, but in the United States, this machinery of recall and prevention, and start to see the dental practice at 3 years old. Remember these little
first
kids?
tooth. First tooth.
Okay, first tooth. And I have never seen anything like it in all my research, where we have such a machinery in place and scare the heck out of people in the United States to come to the dentist when you're first born, pretty much, and so that's where we start looking for that's where we start screening for problems. And the interesting thing is, I remember to this day having a 4-year-old in my chair, and the mother was in the room with me, and she was so upset that her mouth of her child was always bleeding. The gums were bleeding. She did everything she could. She fed the child and all this, and I look back then, and if I knew what I know now, I would have immediately used an infrared, find out what the soft tissue is telling us. X-ray is great for hard tissue. Right. It's great. We need it. We need for that TMJ joint. We need for the mandibular and the maxillary and the sinus, and we need it for the neck, especially ultrasound combined with infrared imaging. But the soft tissue is where we really shine with the infrared, because that soft tissue is going to give us lymphatics, it's going to give us biochemical information, mechanical stresses on the muscles, and it's also going to give us electrical nerve burnout and information. So the information we gain from infrared imaging is bar none way superior. In addition, they always call it an adjunct. No, it should be a companion with hard tissue in the dental industry, because in the head and neck area, and all the research I've done is that's a hard drive. It's descending. Everything descends from the head and neck. And if the dental industry doesn't get on board and game on with the medical, all the medical is going to be doing is chasing symptoms. And without infrared imaging in the dental industry, you're not going to be able to locate specific areas of what's going on in the hard drive of the brain to give those poor signals into the body. And the dental industry has to change. And dental hygiene has to change and start becoming investigators versus treaters. What are you treating? You're treating symptoms. You're treating, poor acidic conditions. You're taking off calculus. It's like cleaning the barnacles off the bottom of a ship when you don't know where the ship's located. You're just, wherever it is in the ocean, you're just going to clean the barnacles off
Right.
of it. So yeah, it's definitely here to stay. And I really encourage dental practices to look into infrared imaging, because that is going to give them, of course, they're want to hear this, another source of billing, but also another source of investigation for treating myofunctional dentistry. If you don't have infrared, I don't know how you could treat or even diagnose or have a greater assessment of the swallowing of any of those facial nerves, any of those cranial nerves, because it all ties together and shows up in the infrared imaging, as we'll see. These what do you call, lateral shots will show the stress on the joints and the stress on the tongue. Everything is listed there to launch from into more care. And if they think that it's just an extra tool to do and take up my time, they're totally wrong, because what we're doing now in dentistry is, like we talked about, how ancient is it? I had an office I spoke to last week, and I said, think about it. The dental billing hasn't changed for how many years? The 1110 code and the 4341 or 4345 growth scale. I mean, that hasn't changed since, I mean, I got out of school in the 80s. It's still used. They don't have any change in their billing, and I went and even had a dental exam done just for the fun of it. And they right away had to put me into gross scale or fine scale. So I thought that was interesting. It's like, okay, I no time warp. You're still
Gross
in the.
scale and fine scale was already off of the table when I graduated in 86.
Mhm.
So that just tells you how backwards that particular office was. I'm
Oh,
shocked
it's
that that was even a
these.
conversation.
This is in Las Vegas in these
Hmm.
franchise clinics. So yes, they still have those same billing procedures. And there was no look for cancer. There was no look for any kind of systemic issues. It was like, get you in, get you out, next, 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 and I thought, what a shame, because look how much they're missing.
Well, I want to get going on this now. I've had this camera for a little, well, maybe 2 weeks. I did finally get the FLIR camera, and I
Talk about
had
what it is. It's an
I
infrared imaging camera. Go ahead, Shirley.
I had actually you found it for me on eBay, so I bought a used one, and it had the software from the older version.
Mhm.
And so I had that updated. And then I had a trip planned to visit family down in Florida. So I got back on Wednesday. And so Thursday I was, you know how it is in your first day back after a few days off, all of a sudden everything has to happen. So I'm just charging it now. It's been on the charger now for about a half an hour. And what is the best way for us to use this thermo camera? And I guess in order to get people that are not quite up to speed. So it's going to take pictures of temperature, and it's going to show the temperature in different colors and different tensions from what you've been teaching me. Now you're going to correct me if I'm wrong.
Uh-huh.
And
Well,
in different inflammatory
yeah.
situations in your head and neck,
Well,
that's all what I'm going to use it for, are going to be different colors than healthy tissues. So the nose, for instance, will turn out to be like a cold color because it's out in the world. And then, the interior is going to be already warmer, but we're going to look for different gradations of different colors.
now one thing I had to learn, I went into it with the temperature and the inflammation mindset, and I used it for
Mm-hmm.
many years, but that's not what it does. What it does is measure the stress of the frequency and the temperature, the stress on the nerves.
Okay.
And the body is going to be in either sympathetic or parasympathetic. And the best way to learn infrared imaging is to become certified. Certified on the use of the camera equipment, certified on the training procedures of how to implement it. One of the questions I get asked is, how do we use it in an environment where we've already got no time? Where do we fit this in? I said, where do you fit the dental X?
Things that I think is a real big drawback in dental hygiene world. There is stuff that we do not have to do anymore. There is just stuff that can drop the heck off of our little time with our patients and be supplanted with some of these better processes.
Well, what they are, and I tried to use them in my clinical time, was screening. I even had a
Of course.
microscope, and the thing is that their mindset is so set on, greeting the patient, taking the updated her version of health history. Any changes? No. All right. And pull out your instruments, do your quick scan of tartar. That's all you're looking for, is how much work you have to do. Pull out your tools, do your job, lecture the heck out of them, make them feel terrible that they've been not doing what they should have been doing, and then put them up, tell them to go to the front desk and schedule for a recall. What a shame. I mean, that is so archaic and that's so wrong. And I say that when people come in, look at them as a whole person. They're coming in from an environment where there had a lot of stresses. And now with the cell phone added to your life, you have even way more stress, because that cell phone is almost like a chain around your neck, telling you and guiding you and um, giving you false or true information. And people are misled by health. They'll see a video and I'll start doing this, I'll start doing that. And so really the dental hygienist has a responsibility to take this person as a whole person, listen to them, do an investigation about where they're at. If they're going through an emotional change in their life or a work environment, that's all going to show up in the mouth, and it's going to
Well,
show up
let's
in the
see how it
tissue.
does. Can we go over the camera parts?
I would say sure. The camera, the purpose
Okay.
of but the thing
Here's
is,
my camera that I bought. This is the battery and it comes out, and this is how I charge it. I don't have a charger just for the battery. I have to charge it by this little guy right here, but I have not been able to find out if there's a place on here that has, this is real similar to your camera, right?
yes, I
Yeah.
haven't. Yes.
So there's no place to put a card.
No, no, you have to upload it through the cable
Okay.
connection.
So I
Now
have the cable is
that's
plugged into the back of my computer.
Now that said,
Well,
some of the cameras have Wi-Fi now.
okay.
And you can, it as you take the image with the camera, it goes up into the cloud.
Right.
And you can
So
take it,
this is
yeah.
an old camera, right? It's a used camera, so it's not going
Uh-huh.
to have all of today's advanced features.
It,
So
it
this
it
is the,
probably does have the Wi-Fi, Shirley. You got the
all right.
upgraded, it's the software. The camera's just the tool. The
How
software
would
is
I access it
you would see it in the settings.
once it's plugged into the
Uh-huh.
computer? All right.
Well, no, once it's turned on.
All right. So what's the best way to turn it on? Because I still have to press all the buttons to get it to turn on.
This is a very, very, very dumbed down instruction on camera
Yeah,
use.
that's where we
Okay.
want to start, right?
All right. Well, yeah, I guess
Because
so.
I
I mean,
pressed this one first, I pressed that one first, and I really, because it's been a few days, I don't remember which one actually turned it
well,
on.
the smaller button is what you push. The power button is the really tiny button.
Okay, so that's not I for information, that's the power button.
Yes.
Because I was like, oh, I don't need information yet, I just need to turn it on.
Well, that's where you
So,
gather the information by turning it on. Yeah.
okay, yep, there it goes.
And I always make sure the lens is open so you're not heating it up. Yes.
So
It's not,
that's the
it's,
lens closed, and then I have a slider here, so now it's open.
yes.
And it's loading, and it says special edition.
Yes, that's the upgraded software. The camera is the tool of collecting the information. The software is the key to upgrading the type of image that you can take.
So this is the image of me, just bare naked. But of course,
Which it's kind of hard to see on a video camera.
it's really hard to see. Yeah. So because of there's glare and all this stuff. So
I would image your hand and then turn it around and take a picture of your hand, especially dental hygienists. If anything,
okay.
get the camera. I always take my wrist and my thumb. I see it. It's just burned out from all those years of, instrumentating. So
Okay.
once it's launched, just hold your hand out and take your picture of your hand.
And then this is the trigger for the photo. Is that
For
right?
taking the image, correct.
To take the
Well, okay,
image. And it's not photo, it's
it's
image.
image. Now, one thing
Yes.
I want to point out is I had somebody that purchased a handheld camera and it was top heavy because it had all these extra features and it was manual adjustment. You don't want manual and you don't want a camera. I would say the E4. People are, we're saying camera, Shirley, but we're gonna get looked. And a FLIR E4 is no longer made by FLIR, so you could buy a used E6 FLIR E6 handheld and then send your camera to David Bramwell. He's the one that updates the software on it. Does a very good job and is very affordable. And that is not top heavy. It is a light camera, isn't it, Shirley? It's not going to wear your wrist out.
No, I think it's fine. It's
Yeah.
not weightless, but it'll be fine. And that sounds like stuff that we should give in the second level training
Well, and
about getting to somebody else.
It's not so much training. What we're doing right now is exposing people
Right,
to
right. So,
I mean, the thermal cameras 30 years ago were big and bulky and they needed a tripod. Now we have technology that says you can hand hold it and you can be portal more, it's a mobile, I mean, and you can take it from operatory to operatory and it doesn't take up a lot of space in the operatory. You also can put it in a little case that it comes with and keep it in the case just in the operatory. So really, it's not anything that's not practical in an operatory from what I see. And it's affordable. How much did you spend on the camera? I mean, and these cameras are great. I love FLIR products. I've tried different brands, and FLIR has a military background in making these cameras from Sweden for almost since the 1940s. So it's a very durable camera in an environment, especially like dentistry, where we're going to use it on almost every patient.
so I plugged it in for the very first time, and then this opened up for me.
Yes. And so
So
did you take a picture of your hand?
there are already pictures in here. So I would
Okay, so
imagine
then,
these
and
are
then
the
you want
pictures that are in here.
what you can do is hit details and view it in large icons. Uh-huh.
So somebody took a picture of a dog or something.
Well, these are templates in there just as samples. Yeah.
Right. So, and I think this was me. Nope, 2010. So what's this one? Oh, they're all listed as 2010. Oh, here, yeah, 2010.
So find your hand that you just did. I would take one today. and just use it today.
Well, I want to get sure that this is all like working and how does it work? And so in the camera, I saw that it has, maybe the date is just set wrong. So I'm pretty
Uh,
sure this was me. No, I did not have a green or a curtain behind me. Yeah. So the dates are not set on the camera.
so you have a settings on the camera that you put in.
On the
And
camera itself or on the,
inside the software, yes.
okay, so in
You
the
have,
software.
yes, you have a dashboard in the camera to put your settings in.
Right here?
It's in the software itself when you're on the camera, not in the
Okay,
folder.
so where would I find that in the
Well,
camera?
this is all training. So this is something we can't really go into detail, but I would
Okay,
say the training will teach you how to set the camera up and how to put
right.
the, all the, organize your folders. And but for now, I would say just the exposure is just to take a picture of your camera, of your hand, and then go through the process of uploading it and just talk about it,
All
the
right, so I'm going to take a picture of my hand. So
and you
let's
have to
see.
unplug the camera to do so.
Okay, that's interesting. All right, unplug the camera. I'm going to stop the share.
Uh-huh.
Now I'm going to go like this.
And your
Should I take
fingers
my
apart.
rings off?
No, but I would have your fingers apart. Uh-huh. And take your wrist. Show your wrist where you all, because that's where
That's my wrong wrist. So I'm going
yeah,
to do it
take
on
your
this other
hygiene
hand.
wrist and take your right around your thumb area and things like that. Yeah. And you'll see the hot spots, what I call the nerve. Nerves are,
Okay,
when they're damaging, they're going to be hot spots.
done. Now what?
Okay, so plug it in. And mind you, we would take more than one image on a person's
Well,
head.
right. We're just messing around right now.
Yeah, we're just fixing it.
Okay.
Okay, so now you want to share your
So,
screen.
yep, hold on.
And really, it doesn't take long to plug it in. Or if you have the Wi-Fi set up, you just click
Oh,
on
it
the
goes
folder.
right in. Yeah, so here's the
Yeah.
picture.
Okay, so scroll down to find your hand. Is that your hand?
This is it. Mm-hmm. Is
Okay, so click on it.
that what you expected?
Yeah, you just click on your hand. Just click on the image.
I did.
It's not launching, but that's okay.
Okay, hold on.
What I usually do is
There we go.
yeah, so now you have an image to look at, and you can adjust the image in the Fleur software, or you can use as is. You see how you have the purple background?
Yes.
So there's another step involved where you can, depending on your time, you could just focus on the white spots. And you have how you have the outline of your hand kind of off? Well, that would be fixed in the settings. All of this is
Okay.
fixed in the training and the settings. But you see how it highlights that part of your hand. Do you have tenderness there?
No.
Do you have tenderness on your wrist?
No.
Okay,
That was, so I was holding the mouse now for
uh-huh,
this amount of time, before we got to the picture. I
uh-huh.
would imagine that that is where the heat is coming from the mouse.
Actually, no, that's a tendon that's really hot
Oh, okay.
and on your wrist. So that's
Here.
nerve. That nerve
Okay.
damage is starting in those areas. And remember that infrared imaging shows early indicators 8 to 10 years before there's an actual symptom.
Cool.
So we have a lot of wiggle time. I tell my clients, they're not patients in a wellness clinic, they're clients.
Mm-hmm.
But the goal is to reverse it, put it in remission. And actually what's causing it, and something that's coming in from the hands, this is where it's going to be fun. You have to go back to your anatomy classes
Okay.
because this is coming from the neck. And these nerves
Or it
are
could be coming from the neck, is what you're saying.
oh, they are coming from the neck. You can see them in the anatomy.
Right.
You have descending from the neck into from the spinal cord. So those nerves are generated in their I want to say their start is coming from the um, occipital area of the brain. So you have the bottom of the brain, for lack of words here that are anatomy, but it's grouped in at the occipital lobe. So what we have is anatomy like crazy, and that's what I put into Dr. Link's is the overlaying of the images with anatomy so that we could learn about it and refresh our memory where these nerves are overheated. And once they're overheated, they're going to start poor circulation into the areas inside the body. And could be because we're out of alignment in our occlusion. And I would say 99% of the time I see malalignment and misalignment in the neck from car accidents. And people are grinding their teeth because they have poor circulation of these nerves in the structure, in the rotation of the TMJ, and also the vertebrae. In the atlas, the vertebrae C1 is not sitting correctly, and it's putting pressure on the cranial nerves. So what we have is a lot of information happening. Teeth are breaking, teeth are decaying, teeth are getting chewed on, tori is being built up, and all of these are indicators of nerve damage that we can pick
Okay.
up in soft tissue with the infrared.
Okay, in the soft tissue, not in, you're not going to see a broken tooth necessarily. Although I did see with this, what did we call it if we're not calling it a camera? Imager?
It's a camera,
Okay, so that there's a
infrared
actual
camera.
image and there's also a thermographic image. There's
No,
two images that are taken, but
there's a yeah, there's a digital photo, an actual camera photo.
but I did not see that in the folder.
No, because your setting is not showing it.
Okay,
So that's why setting is so important to work with an instructor. You work with
right.
someone to train
Okay.
you on how to learn how to use it and instruct it. There are quite a few videos out there talking for engineers, if you wanted to get a taste of it. But the engineers are using it, the electrical engineers are using it for testing the wires in the walls and seeing where the
Oh,
stresses are.
yes, sir. Sure. Okay.
And there's no difference in the body. So we're searching for the electrical wires that are stressed in the body, and that is the nervous system. So you will find that the camera has a lot of features on it to view, and you can view it in different color palettes too, which is kind of fun. But for the most part, I use high contrast rainbow because I like to see the hot spots and the cold spots. And cold is poor circulation of the nerve. So inflammation is a symptom of a burned out nerve. And so we always want to start with the nerves. The electrical systems in the body are the dictators. And if they're not flowing, just like a stream, if they have brush in them, the stream has to reroute. So what is the body doing? It reroutes the nervous system descending from the head and neck. And I told a dentist last week how important dentistry is and how dentists becoming physicians is so important to learn about these descending brushes or the blockages in the obstructions from poor occlusion. And he knows. He's taken the classes with Dr. Clayton Chan, and he's been teaching. Dr. Clayton Chan has been teaching for years, and we interviewed him on our podcast.
Yeah,
And
just a
so
couple weeks ago.
this is a dentist that took one of his courses, and he's at level 5. There's late levels to learn. I spoke with a dentist that when I was speaking about the neurology, and she was saying, we don't learn about this in our training in school. I said, correct. So we have to learn about it outside of school. The infrared imaging camera is going to pick up nerve damage. And you might say, well, can I look at a nerve in an x-ray? You can see the abscess, but can you see it going into the lymphatic tissue? Can you see it going down into the chest area of the heart? No, but we can with the infrared. So yes, the camera is a tool to assess nerve damage. And that's going, going to show us where parts of the body aren't working as well. And like you said, the swallowing, the position of the tongue is all nervous driven and mechanical. Where's the mechanical from the car accidents or whatever kind of accidents, falling off of horses
Right.
or whatever, that's going to change the direction or change the signal of the nerve or put stress on it, and that's going to be picked up in the camera. So yes, your hand, you said no, 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 but I would say, well, if we looked and did some more research, I would look at the back of your neck with the camera and see, look at all the stresses here and look at the compression and it's shooting down into the hand. You don't have a symptom yet.
Right.
It's
Well,
there.
that's it, right?
And that's what you would
Okay.
find with your myofunctional. They might not be symptomatic yet, but it's there that you could correct. So it gives you information to early correct years ahead of time. And what a lifestyle someone will have. Also, airway. I think one of the things that dentistry is going to be really needed is opening up airway for these medical situations. You don't have the oxygen going into the head and neck area. You're a time bomb. So, in a medical condition, and the dental industry will be responsible for opening up airway
Or at
because
least
they have the training.
evaluating it. I mean, you
Yep.
can't always open it.
Oh, yes, they can with their training on the occlusion. With the occlusion and repositioning the skull, working with chiropractors in a village. Oh, absolutely. You can't, dentistry is the part of the team. There's no way to practice healthcare without dental care. And
Mhm.
that it's just a combination of communication between the dental and the medical.
So it's plugged in,
Uh-huh.
and I did take another picture of my hand. I made
Oh,
some changes,
okay.
and it's not better. So obviously, I need another little training session. But I don't want to skip out on doing this and uploading it then to the Dr. Link site, and then how we would use it there.
Okay. So what you
So
do,
what's the next step then?
well, then you're going to imbue it into Dr. Link. So you're going to open up the software and
Okay, so
it'll be on the desktop. So it's just a matter of your folder and
what do you mean it'll be on the desktop?
right there, you have it in your folder right there, your hand. So you just want to slide
Yes.
it over. Now open up Dr. Link's. And so you should have it side by side.
Okay.
So open up a patient file
So
in
we have
Dr.
to
Link
make a patient file.
or open up an existing one.
Am I in here? I know I messed around with it a few times already.
You, right where it says add new patient, you can add a new patient. You can just add a test or use one below that you have. Just scroll
Right.
below.
And I'm wondering if I'm already in here. So this would be where it would be.
Yes.
Okay. So,
So you would choose
oh, I
yourself.
am right here.
Yeah, just choose you. Okay, so once you're in here, we want to skip over to this requires the training. This is just getting a
Right.
snapshot of the profile. So go to screening tab. And then in the screening tab, click on the visual tab. Let's see, do you have the level 1? Let's go to greet. This will be good information here on the permission. And then scroll down and click on dental to the
Okay,
left.
hang on.
Yeah.
Is it down here more?
So
Oh,
where
here
the
we
one
go.
is,
There
yeah,
it
there you
is.
go. Okay. All right. So now you want to click save. It should automatically save, but below there's a save button. Yeah. Okay. So now let's go to the screening because that just gave you permission to upload and then click on the visual tab. And so now we're in upload.
Oh,
Okay, so what you'll do is
you
now
put
this
some people under my name. I don't know.
is
These
so
don't look like me at all. Go
that's
ahead.
okay. All right, so what I would do is click on the upload the library because you're going to put the image in the library below where it says Thermolinks. It should be Dr. Links. We're changing the name. So anyway, go down to the below the images
Oh, down here?
where it says upload library above. Yeah, and then what you'll do is you're going to click on examination to your left where it says 224. So that underneath your name on the very far left of the screen.
Okay, I'm not seeing my name on the very far left. I don't know if it's cut off for me or what. There's a big X.
You're looking at the X on the opposite side of
Oh, the
that.
other left. Oh my God. Okay, go
So
ahead.
click on examination. Okay, so what you can do is now slide your image from that folder into this folder. So it's drag and drop.
So this one
There
here,
you
like
go.
that.
Uh-huh. So
Okay.
now
Will it
you're in
bring
there.
over the digital
And then,
image too, or just the
yeah,
thermographic one?
that's just well, that's in your training. This is just a
Okay.
quick
All right.
overview. So what you would do is take that image and drag it over to any one of those spots, because this is just a demonstration of how easy it is. Just take the
Okay.
image and you can drag any image over. More, or you can add, you're going to take about 6 images when you do put them in
Right.
your folder. So take your any one of those and drag it to the right where it says frontal head. You
To
could
the
just,
right.
so you'll click on the image and then drag it over to, yeah, there you go. Uh-huh.
On top of this
On
other
top of it.
image?
Yeah,
Okay.
yeah. You can just, and then click out of the X and then click the X. There you go. Uh-huh. So now you want to scroll up. And so now you're inside. You want to scroll up a little bit more, a little bit more. There you go. Okay, so now you're in there. So now this is where the training comes in and we put the digital, but now you can see it. You can also do side by side with the digital. So we would add your digital image, your photograph, and your infrared images side by side so you could see it overlap, which is kind of cool.
Yeah. No,
This
that's
is
really
just
cool.
playing around, but if you click on the photograph or click on the infrared, any one of them, now click side by side at the top. That's where you'll see, and then overlay, if you click on overlay on, then you could, when you have you would size it up to overlay and you would have your
Right.
digital and it's just really fun to see how you would start to see the mouth in the infrared.
Mm-hmm.
And
And if
also
they were the same image, yeah.
right, if they were the same image, and you would see instantly where the nerve damage is starting to happen in the cranial area and the facial nerves and especially side views, lateral, there's just so much you see. Oh, it's in, and you don't really need to do much. This is about
Right.
it for the introducing it to the cases. This is where dental hygiene can really shine. I would reappoint them to say, you know what, we need more time for investigation and to take your mouth images and upload your dental x-rays into this. And it's going to cost between $500 and $800, but your insurance should cover it. We have a, dentist license, and this is an investigation, examination, and it's covered under the CPT codes, and I have those codes. So in that 1 hour, the dental hygienist gets a break from cleaning teeth with instruments and does this investigation. And wow, can you imagine, Shirley, what we'll find out in the myofunctional area and also in pre-stroke? I've seen pre-stroke, pre-heart problems and lymphatic drainages, and we use our training, we use our anatomy now that all we learned. We had to be tested on it so much in school, and now we get to use it.
And then isn't there a way to look at this image over over a
Okay,
skeleton?
you now click on 3D below the image, below the mouth. Absolutely, I have that built in. Yes, you got that right. Yes. So now you have a 3D image that you can use as well. And let me tell you, it is fun. And you can click on it and find out what nerve, and you can go to town on this. And you have to learn to size it up. We don't have AI input yet because that was new. But you would and then what I like to do is get the girl. If this is a girl, you go to your
Yeah,
far left
I did.
and
It came up as a girl.
yeah, so you take that little indicator, that little slider and go all the way up to, you want to go a little bit more till you get the girl. To the very far left, slide it up. I would take the slider up again you can just click on the slider where you have that person to your left. You were sliding before. There you go. Now you can, I like to use this as my kind of my base, and then I measure it up, but I can enlarge the person just by clicking on the white space and rolling my mouse. So you can just, how you want to increase the size. Yeah, there you go. I get the head and neck. I just drop her down and get the head and neck. And this is really fun to do. So you just increase it a little larger even. There you go. And this is fun, especially in thermal, in the infrared, because
Yeah, I don't
can
know
really,
why this picture came up. I thought I picked up the other picture.
you clicked on it, that's why.
Well,
You
I
clicked
didn't
on,
intend
yeah.
to. I don't know how I clicked on it. I wanted to click on the other one. Okay.
Well, you could click out of this and do it again. So click out
Yeah,
of the
let's
X, click the X, and then scroll down again and click on the actual picture. There you go.
this one.
Yeah, but that will give you, I'm sorry, click X again. Oh, because it's in the, you have the infrared image in
In the wrong
the wrong
square.
spot. Yeah, that's why.
Oh, okay.
But if you have the image on the right, then it will show. Yeah. You can change it in the library. So if
And
you
how
go
do I
back,
do that?
you just go scroll down below. Just scroll down to
Oh,
get the
here
library.
again?
Yeah, go to the library and then just switch it over. You'll click on your examination folder to the left. Yeah, and then just drag it over to the right. Yeah, there you go.
Okay, it didn't stick. There we go.
Okay, then you just X out of it. And now click on, yeah. I'm sorry, now you're going to click on 3D. I know.
3D.
Yeah, 3D. There you go. Okay. It's
Yeah,
a
I
lot
can
of
see where
fun.
you need a little bit of training, but it's fun to just mess with it and
Oh
stumble
my gosh.
across really good
You're,
solutions.
I'll tell you, it has been a blast, because I'll click on the actual nerves and circulation and say, look at that. What is that? And what you can do is, if you take your to the far right where the images are, and after you size it up, click it. I didn't even know I had this feature till last week. We put so many great features in there. Now your head is a little bigger than you can enlarge your thermal, your infrared image to the far right where it says plus above the images. And I usually use the girl as to size up the eyes and the nose versus the skin versus the muscles and everything. But
Right.
you can still play around. Oh, there's just so much fun. I can't tell you. It's a lot of
Yeah.
fun. And you can see how using our knowledge, we will use it. And you can scroll up, push that all the way down, pull it all the way down to the bottom, all the way down. And now click on any of the 3D to your left, click on anything to the image, on the image, click on the image. Okay, so now take your far right, your infrared, and scroll up. See, look at that. You can go all the way, put your temperature a little higher. Yeah, just keep it, there you go. So you can start to see areas pinpointed, and you name it and really get the information. It's just a
Wow.
lot of fun. And it takes practice, but the goal is to make your notes so that for your team, they have it in the notes and they know that this is an area of concern. And the fun part about it is it's fun. And as we're teaching and
It's as
instructing.
fun as scraping calculus because that was a lot of fun at the beginning too.
Oh, I loved being a clinical hygienist, but at the
Yeah.
same time, I tried to explain oral systemic and it was difficult without charts.
Right, right.
or a mirror.
We had no way of helping patients like visualize anything. And then we were stuck with floss or die, and then that was ridiculous. And
Yeah.
everybody knew it. Everybody knew it. They knew you were full of it, especially the physicians. And then you just lose credibility points like over and over again because there's no such thing. But this kind of stuff really gives you an idea of how best to really
Well,
find out the information because you don't know all of this is happening and to present it to your patients.
and also, I want to just stick it in here. This is a launching pad for
Yep.
dental hygienists to go into what I call dental medical hygiene.
Yes. Yep.
Because now people are saying, I want to have career options. I've been working in wellness clinics and taking this information, not just head and neck, but full body. And I'm charging between $500 to $800, and it takes me an hour and a half to collect the information, and it takes me another 2 hours outside of the uh,
Yeah. To
of
assimilate.
to assimilate it. So my day can be around $1,000 just taking these images, and I have a blast because now I know the dental, I know how to tie it all together because the software uses the information to tie it together and come up with some impressions that I give the doctor team or the provider team, I call it, and guidance to the client. I am now using my knowledge I wasn't using before, or I got in trouble for using if I was cleaning teeth. I couldn't say much about systemic.
Yes. One doctor told me explicitly, don't talk about it anymore. I haven't thought about it in a long time. He says, we just don't have enough information yet to be making any kind of commentary. And I thought in my mind, the veterinarians know it. They look at the gums of all the animals to see how is the heart doing. And I have to wait. It's just malpractice in my mind. It's just malpractice. I really, really, really never ended up in a dental practice that was um, like a hygiene heaven for me. It was just always very, very, very uncomfortable. Then I had to sneak conversations, and that's not fun either.
No, and surely what we're offering are launch pads for our profession to evolve out of the
Right.
mouth and into the body. So it's exciting,
So,
and
what does the
we're it.
training look like right now for you?
The training will be, and that's a great question. The first step I do is an assessment for the practice. Dental hygienists usually are hesitant to go out on their own. And when I did teach, it was difficult because they didn't have any setup. And I didn't have the training
What
to
did he
give them
say?
to go open up a business for this. Okay. So I would recommend taking the infrared images with the dental x-rays or at the other alternative recall appointment. So every other appointment, you're infrared, then dental x-rays. So the training depends on how much information they want to take. If they want to take it just to take the images and educate, like we did today, okay, you got a problem, Mr. Smith. And then Mr. Smith says, well, what do I do about it? Well, we can go to the wellness center and get more information. Or I could train, and that's an introductory training, and the cost is a lot less for them just to image and get the certification for dental medical thermography imaging. Or they can take a step further and say, well, we want to produce the reports. And that means telling the front office and the back office that hour is going to be dedicated to infrared imaging and using the software to put the data in to discuss a report. That's a whole separate CPT code. So if they wanted, the office I was in last week, they're excited. They go, we want to do the reports. Okay, well, you want to take the reports, then you're going to have to look at, instead of 8 clinical hygiene patients a day of cleaning teeth, you're going to have to fit in or put it on another day where the hygienist is just taking the images, taking the reports, taking what I call the Dr. Links reports, dental medical infrared imaging reports, and that training is going to cost more. So the training can vary between 5,000 to 10,000, and the certifications and the hours input of learning. What I'm discovering is we are introducing a whole new area of data intake and screening that hasn't been cultivated. It's been there dormant, but we haven't used those codes. So it's a matter of training and putting that introduction into it. So the dental portion is where I would start, and the head and neck. Then after they've been doing it, maybe a year or 6 months, and just say, I'd like to learn more and go into the body and image. Then we connect, they've been connected with wellness clinics, and the wellness clinic will hire them, or they'll go in as an independent contractor and have appointments set for them to image the rest of the body, infrared them, and then tie it together with the dental. That's amazing because we're the only profession, not even nurses can do this, that understand this head and neck anatomy the way we understand it in the oral environment, and tie it into what I call they call the tooth and organ, but it's neurological pathways.
Two things. One, when you're taking just the head and neck, do you have them still take their shirt off? Or do you just have them like go like this and like that? So what I did is I went over to Goodwill and I bought some t-shirts with some straps, and they can change in my one room, and then I have better access to everything. How do you do that?
That's a great question. For a separate visit, yes, have them put that on because you have the time.
Mm-hmm.
For introducing the concept, leave the, especially with turtlenecks in the winter, you just have to push it down, and that's it. It's
okay.
And maybe move their hair over the ears a little bit so you can get more of the facial and the trigeminal nerves, because less is more. So you just image and image. I call it 3 clicks. And if you want to get the back of the neck, go for it. And then show the patient there's problems.
Right.
And that's
okay.
it.
The next thing is with respect to a dental hygiene practice, or the dental hygiene practice within a dental practice, which is how it's usually done. Patty DeGangi and I have been floating this balloon of a risk factor manager. Dental hygienists are pretty brutalized. It's a very difficult job. The ergonomics are impossible. There's a lot of muscle pain. A lot of hygienists have to have their thumb knuckles replaced, or they have to quit because their hands are bad or their neck is bad, thoracic outlet, blah, 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 it's on and on. So what we were proposing is somebody to do as part of an appointment. So it's now a 90-minute appointment. 30 minutes is with the risk factor manager, takes all the x-rays, in this case, all the images, do the slides for the microscopy, do the blood sampling for blood values for disease management and health management. Maybe that's a better way to go. And just do all of these little risk factor things that nobody has time to do because we're busy cleaning people's teeth. But we need to get it in. And then maybe if there's 3 hygienists, week one hygienist does it. Week 2, hygienist 2 does it, and week 3, hygienist 3 does it, and then you keep rotating through, so you get a week off from this body morphing clinical practice. And everybody thought that was a good idea, but they couldn't see a financial benefit to it. And I was like, it's going to be the same cost, because you have codes for the blood testing, you have codes for saliva testing, you have codes for x-rays, you have codes for dietary diet diaries, you have codes for all of these different things. And now we also have codes for this thermography piece. The wrinkle is that you have to use medical codes.
Yeah, cross-code.
And they're just not on board with that. And hygienists abhorred codes. So there's ways to do it. You get to do what you like. If all you like to do is little kids and scraping junk off of their teeth, that's fine. That's the job for you. If you are a 30-year hygienist and you are tired of 3-year-olds and your hands hurt, but you still like working, and the office politics is still pretty good for your office, this is a really good way to increase the benefits to your patients. Patients had a huge pushback when we started wearing gloves and masks. Huge. I had people walk out. They were so insulted that I wore a mask. And this is going to be the same thing. They're going to wonder, what the hell are you doing? I just want my teeth cleaned. So at the very least, these conversations should be happening right now. And we need to up our conversation level and our vocabulary so it will match with medicine. They are not going to match with us. We've been diminutive languaging our way into the poorhouse right now. And our value to medicine, as you know, all of this upheaval now at the government level, nobody talked about getting a dentist involved. Nothing. Nothing. And it's insane. All of health starts here.
Yeah.
All of it. From infancy, from before delivery on, it all starts here. And we have been terrible, terrible stewards, and we have been terrible at a whole bunch of other things. So I see my patient is here now, and I better calm down. So,
Amen.
So this was a really good conversation, and I can't wait to get it all uploaded into Rumble and YouTube and Facebook and all of the rest of places.
Yeah, so we got to get you trained and certified.
Yes, we do have to get that going too. So let's schedule that. But as I said, my time is gone for right now. And well, we'll just keep on keeping on. My name is Shirley Gutkowski. I'm the owner of Primal Air, and you can find out more about Primal Air and what I do at primalair.com.
And my name is Victoria DaCosta. You can find out more about this infrared dental medical imaging on Dr. Links, DrLinxs.com.
Sweet. Thanks, Victoria. Thanks.